Good morning, friends. Welcome to Dr. PM Times. This is Dr. Murugesan. Friends, in this episode, I am going to concentrate on the drugs that are used in the management of diabetes. So, the primary problems we have to address is bringing back the blood sugar to normal, and that too, we should bring it back as early as possible. The problem is hyperglycemia, and if the blood sugar level is very high, say more than 300 milligrams per deciliter, then there occurs signs and symptoms of glucotoxicity, which can affect all the cells from head to foot and can even affect the very beta cells that secrete insulin. So our primary aim is to bring back the blood sugar level as early as possible to normal, so that the beta cells can regain their function. Whatever leftover beta cell can regain its function early and start producing insulin, which will help our treatment process. So in that, we have numerous drugs that are available in the market now. The gold standard drug, just like paracetamol being the gold standard for use in the management of fever, metformin is the basic drug which is very useful in management of diabetes. Metformin not only decreases the hepatic release of glucose, it also augments the peripheral insulin sensitivity and just improves the peripheral blood glucose uptake. This brings back especially the fasting blood glucose level back to normal, and metformin is very useful, especially in the management of an obese middle-aged type 2 diabetic. Apart from this, there are various group of drugs which we have to weigh their pros and cons before advising. Say for example, sulfonylureas. These are a group of drugs, example glimepiride, glycoside, etc. They act by squeezing the beta cell and releasing the insulin. As I have already mentioned, by the time the person becomes an established diabetic, 60% of beta cells are already gone. Only 40% is left over. The aim of the treatment is to preserve these 40% leftover beta cell as much as possible, because there is no available drug in the market that can regenerate or bring back the lost beta cell. So our drugs that we prescribe, we should be very cautious in giving the drug so that it doesn't augment the beta cell exhaustion or degeneration. These sulfonylureas over a long run, say for example 1 or 2 years, first 1 or 2 years, it is helpful in bringing back the blood sugar to normal easily, because it squeezes the remaining beta cell and releases insulin. Whereas in the long run, it causes beta cell exhaustion. Degeneration is augmented. So entire beta cell population gets destroyed over a long period. So we should be very cautious in writing or prescribing sulfonylureas in type 2 diabetic, especially if he is diagnosed for the past 5 years. Instead, nowadays, newer drugs have come. Say, for example, the drugs which act based on the incretin effect of insulin release, say the gliptins. These drugs are supposed to be more physiological in augmenting the release of insulin by stimulating beta cell in a physiological way. That is why gliptins are very much used now. There are other drugs which act at the SGLT2 receptors, at especially the nephrons, and prevent the reabsorption of glucose, favoring more glucose loss in urine. Thus, it helps to bring back the blood sugar level and also cause more calorie loss, which will also bring down the body weight, which is desirable in the management of diabetes. Of course, it has got its own problems like increased incidence of vulvovaginitis or belanoposthitis, that is infection in the private parts, genital organs, which is the primary complaint for which a diabetic actually comes to you. Also, loss of glucose in urine means loss of vital energy. So this also makes them more exhausted or more fatigued. So all these pros and cons, you should have it in mind before prescribing either metformin or sulfonylureas or gliptins, which are more physiological, or the drugs which act by increasing the glucose excretion in urine. Instead, the gold standard drug today, even today, to me, is insulin. Diabetes is due to lack of insulin. So give the drug which the person has deficiency. So insulin is the best drug to give in the management of any type of diabetes, because earlier the insulin you give, earlier is the preservation of whatever beta cell that is present, earlier is the blood glucose level control, delay is the onset of complication, more is the life expectancy. and there is also an advantage of weight gain, getting back that lost vigor, the energy level, all those things. So early insulinization is the key in the management of diabetes. Instead of trying with the drugs first and later on switching over to insulin after almost all the beta cells are lost and almost complications have creeped in. So start insulin early so that the complications doesn't occur in such individuals. The control is better, life expectancy and quality of life is more. Thank you.